died of breast cancer throughout the world, more than half of them were from the low and middle income countries. So what's going on? Why is it that the low and middle income countries have to bear such a high burden of cancer? And the answer is truly that there is no screening. There's no breast cancer screening. The patients present very late, and even when they come to the clinic, subsequent care is best that could be very sensitive, so that even in tiny bits of cells, we can detect the breast cancer. And so now we have a test that we developed with a company called Cepheid, and what the test is a single cartridge, just this little thing, that you put your fluid into, and then basically the cartridge does everything. So it becomes very automated, very simple. It's just wonderful. So, and such tests are already present all over Africa, because TB tests are done by the gene experts. They are.
You learned something.
And these TB tests are in all the major countries of Africa.
Oh.
It's universal. The machines are there. The technology is there. All I have to do is to put a breast cancer test into this, which we did very successfully. And now we are testing this in a large clinical study in South Africa. South Africa has no screening either, even though it's a middle-income country. Yeah. So these women come in with these large lesions. The technician basically pinches the breast so that the bulge comes out of the belly.
Yeah.
She puts a needle and takes out a few cells, and then we put it into this. And within 3 hours,
That's amazing.
it's amazing. So all of the reagents are in these chambers. The whole reaction is done by the machine. The results come out in 3 hours.
Where's Danielle? Danielle, did you know this?
She was telling me about it. What do you think?
Yeah. And that little cartridge. I know.
In that
little
little cartridge,
right?
So we believe, so now the 720 clinical trial is going on in South Africa, and the early results are very, very promising. So what is it that we want to do? So another interesting point is that the study is supposed to be 5 years. It was funded by NIH and with the company Cepheid, as well as people in South Africa from the poorest neighborhood, Soweto in Johannesburg. We are doing the study over there, and this study is almost complete. It's going to be completed in the next 18 months, although it's a 5-year grant. So we are very excited about it. The early results are very, very promising, and it's a sad fact. The fact that we are able to finish the study faster means that there are so many women coming every week. At least 200 women come to that clinic with lesions in their breast. Half of them will be benign. So what do you want to do? We want to push the people with cancer ahead of the line so that they can get the answer the same day, and we put on a treatment schedule back very day.
So what other countries is this in?
So right now we are testing this breast cancer cartridge in South Africa, and we are testing a colon cancer cartridge using blood plasma in Nigeria.
In Nigeria. How about in Europe or?
No, we are not doing anything
just
there
doing
because
the
they have mammography. So they are not very receptive to this kind of a new technology to detect breast cancer. And the lesions in all of the developed world because of mammography are very small. And so to find that small lesion and get a needle aspirate, it's almost impossible. So this is right now we are only dealing with cancers that are palpable, but we hope that through education and through knowing about this test, they will come in earlier, in which case an ultrasound will reveal the lesion. You can put the needle and take out the cells and do the same test.
Yeah, that's amazing. We should have more women knowing about this.
Yeah, exactly. Yes.
That's a job for us.
That's right. And the second cancer, women's cancer, we're dealing with is cervical cancer. Same success.
Well, I have a friend who has clinics set up in all over Africa, and she's doing cervical cancer, but she's doing it with vinegar, and she's with these clinics, and if they look in and they see that they turn white, these lesions. Hi, good morning. How are you? Hi. excited and really about how it's so close to our hearts. Then, Rachel, you invited me to your home, and you showed me the amazing work that you're doing to empower women and young people in Kenya, using your platform to make lives better. So I was honored to be able to welcome you and your daughters to my home today, and I'm excited to continue our conversation on how to defeat cancer. Because really, in some ways, cancer touches us all, unfortunately. And that's true in the United States, and it's true in Kenya, and it's true around the world. And so we've come together as communities, as really a global community, to stop it. Because defeat cancer. Is collaborating across oceans to share good ideas and best practices to ease the burden on patients and their families, and to make breakthroughs and create the kind of care that saves lives. So we're expanding access to cancer screenings here in the United States and around the world so that we can detect cancer earlier when outcomes are best. And just as no nation has cancer, and that's why the Biden campaign is sure patient navigation here in the United States. But navigators understand the communities that they work in, and they guide patients from their family and their families from diagnosis to survival, and from scheduling appointments to keeping track of medications to coordinating things like transportation and childcare. And they make sure that even on our worst day, and when you have cancer, you have a lot of worst days, or our best days. We're never alone. And that's what's happening at Kimmel Cancer Center at Johns Hopkins, so that which is so important. And I can't wait to hear more about what you are all doing. And yes, cancer has the power to destroy, but it can connect us as well. It forces us to reach out for answers, for help, for healing. It pushes us to really seek hope in each other. And I've seen that personally. And it inspires us to come together and find the love and support on which our future can be built. Because together, all of us here and all of our networks, we can end cancer as we know it. Thank you. So I'm now going to turn it over to Rachael Ruto, First Lady.
Dr. Jill Biden, the First Lady of the United States of America, Dr. Elizabeth Jeffrey, Deputy Director, Sydney Kimmel Cancer Center, the leadership of Johns Hopkins Sydney Kimmel Comprehensive Cancer Center, and the wider Johns Hopkins University community, Dr. Danielle Carnival, Deputy Assistant to the President for the Cancer Moonshot, and Deputy Director for Health Outcomes Office of Science and Technology Policy. Ladies and gentlemen, good afternoon. Good afternoon. Jambo. Thank you. I'm delighted to join this important session to listen and learn about the management of cancer at this world-renowned institution. Let me take this opportunity to sincerely thank my sister and friend, Dr. Jill Biden, and President Joe Biden for the warm welcome we have received. Thank you so much, Dr. Jill. Let me also thank Dr. Jill Biden for the Cancer Moonshot, which you and President Biden reignited in February 2022, announcing the government's response and the formation of a cancer cabinet to be convened by the White House to address progress against cancer. Thank you to the Johns Hopkins University team for your dedication and global leadership in healthcare, providing lessons and best practices that are of much help here in the US and other nations. Before I continue, receive greetings from our President, Dr. William Ruto, and the great people of Kenya.
Thank you.
The goal for this state visit is partnership for prosperity. Today's event is a continuation of the health engagement between our nations. Just 2 days ago, Kenya and the US renewed our health collaboration with the Center for Disease Control, CDC, in Atlanta. Cancer, one of the leading communicable diseases worldwide, is a pressing concern for every country. For developing countries, the challenge is even greater due to and developing health infrastructure that struggles to manage the high cost and aggressive nature of cancer cases. The effects on families are profound, both financially and psychologically. In Kenya, cancer is the third leading cause of death, making it a major public health concern. It places a significant burden on families, communities, and our health system. The Status of Cancer in Kenya Report 2022-2023, launched during the first ever National Cancer Summit by the United Nations Population Fund, revealed that of all the cancers, breast, cervical, and prostate cancer are the most prevalent. Cervical and breast cancers contribute 23% of all cancer-related deaths in Kenya. People, especially women in low-income areas, as well as in arid and semi-arid regions, face additional challenges in accessing critical testing and screening services. These statistics are of concern, and the government of Kenya is dedicated to delivering universal health care with preventive health care as a top priority. Early detection and treatment are vital. Our government is working towards availing these services to all, regardless of their location or economic status. The recently launched Cancer Communication Strategy will unlock the much-needed information and education campaigns required to raise awareness about cancer risk factors, symptoms, and the importance of early detection. Ladies and gentlemen, the health partnership between Kenya and the United States of America is yielding great benefits, particularly in research, training, leadership in healthcare management, and exchange programs. This collaboration is essential for advancing our healthcare capabilities and ensuring our people receive the care they need. Our government is also working to ensure our health research institutions make significant progress in providing more vaccines and treatments to reduce the burden of cancer in Kenya. I welcome the Johns Hopkins Sydney Kimmel Comprehensive Cancer Center to partner with leading public and private institutions in Kenya. Such a partnership will help to reduce cancer incidences and improve the quality of life of cancer patients in Kenya through evidence-based strategies for prevention, early detection and diagnosis, treatment, and palliative care. I'm looking forward to listening to the discussions and the significant insights that can enhance our healthcare systems and strengthen our battle against cancer. Together, we can change the countless lives of those impacted and bring them hope and healing. To those battling cancer disease, I wish to share a quote from Olivia Newton-John in her song, Why Me?, which is a tribute to her fight with breast cancer, and I quote, "Fight each round, take it on the chin, and never, 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 ever give in," end of quote. Thank you for your kind attention, and God bless you.
Thank you, Rachel.
Those inspiring words are a great place to start our conversation, and thank you to both of you for your leadership and for bringing us together today. My name is Danielle Carnival. I'm Deputy Assistant to the President for the Biden Cancer Moonshot. I have the great privilege of helping lead the effort to end cancer as we know it. As mentioned, it was reignited by the President and First Lady in 2022 with the goals to really drive impact for Americans across the country, to decrease the death rate from cancer by at least 50%, and to boost support for patients, families, and caregivers. This means we need to drive innovation. We're going to hear about that today in new ways to prevent, detect, and treat cancer. But it also means we need to make sure that we reach more people with the tools we have and those we develop along the way. We saw a great example of that next door, and I know we're going to hear more about that. The reason that the Cancer Moonshot exists is because there's so much opportunity, because cancer is personal to the President and First Lady, to me, to every American, and so many people around the world. And it's an opportunity to really deliver for the American people and show people what we can do when we come together and work together. But while the top line goals for the Cancer Moonshot are domestic in focus, the ambition of the Biden Cancer Moonshot has always been global. And so I look forward to hearing more today, because with partners like Kenya, we can drive new research, we can improve prevention and early detection, we can make sure effective treatment is reaching more people and that everyone gets the care and support that they deserve. So there's a lot of reason to have hope, Her Excellency, as you talked about. And we're going to hear from the great minds at Sydney, Kimmel and John, about why exactly and where the opportunities, where the progress and opportunities exist. So first, Dr. Liz, thank you.
Okay, thank you very much. So first I want to welcome First Lady Ruto and of course First Lady Dr. Biden for joining us and joining our Hopkins family. We're very honored to be here and to talk about what we do today. And we'd love to partner with Kenya. And as Dr. Biden knows, I love doing things for her and for President Biden, and they inspired me for so many years.
Thank you.
So turns out Johns Hopkins celebrated its 50th anniversary. This was last year. And it's our mission then and now to continue to conduct groundbreaking research. But our research isn't just research for the point of doing research. We have always been known for translational research. Our research is about helping patients. And we know how to take our discoveries and move them quickly into new drugs for our patients. And we learn and we take them back to the laboratory to try to make them even better until they're perfected. So that has always been our mission. We're also known for developing a number of fields in cancer. The first is cancer genetics, and this began back in the 1980s, when Bert Vogelstein really showed for the first time that cancer is a genetic disease. And this is very important because, as you heard from Dr. Sukumar, with this knowledge, understanding the genes that initiate cancer and then also help the precancers to develop into very aggressive cancer, we can develop screening programs. We can identify people at high risk. So it's really had a great impact already on our patients. And as I talk to you, we hope to utilize this information to even develop vaccines that we can prevent cancer in the future. Our cancer center includes 4 cancer hospitals in Maryland and 1 in Washington, D.C. We also have a number of outpatient centers throughout Maryland, and we see many patients. We see 60,000 unique patients a year. We treat 15,000 patients with chemotherapy every year. We do about 8,000 cancer surgeries. We do 60,000 radiation treatments. And we see total about 550,000 encounters a year at all of our sites. And it's very important to us that all of our clinical systems really integrate. And I've heard you and also President Biden talk about how important this is, and we still haven't done this, but with your voice, I think more and more this is happening, and Hopkins has strived to make sure that we connect all of the centers so patients can move from one site to another seamlessly. Hopkins research is among the top in the world, and in fact we've always been at the top of federal funding. And we typically have about $157 million a year of federal funding. About $100 million of that is from the National Cancer Institute. So that's a lot. The state of Maryland gives us about $5 million a year. We have philanthropy and foundation funding, and that's about $60 million a year. And so in addition, we've also had a number of industry partnerships, and that usually is about $100 million a year as well. So very important, because drug development can't happen in a silo. We really have to collaborate, right? And we have internal partnerships. As there's internal funding, about $5 million. Overall, it's about $335 million a year in funding. And What's important about this funding is that this funding is used to really develop the next generation, the future generation of all of the healthcare workers, research and clinical care. And that's really our number one mission, to make sure that we are developing the next generation. And this next generation we share with the rest of the world. And so we welcome you, and we hope that we can work with you in the future to help patients in Kenya as well. Thank you.
Thank you, Dr. Jaffe, for showing us kind of how robust the research engine is at Hopkins and how connected that is to both patients but other institutions and can make a real difference. I'm going to turn it to Dr. Otis Brawley to talk a little bit about the second part of the Cancer Moonshot Goal, which is how do we reach people? How do we boost support for people as they go through a cancer journey? Dr. Brawley?
Thank you very much, and thank you, Dr. Carnival. You've done some wonderful work over the last decade or so.
Appreciate it.
I am a medical oncologist and epidemiologist. I study outcomes. I study how we can make healthcare more efficient and do things. For example, there are about 600,000 deaths per year in the United States from cancer. But if we were more efficient, 130,000 of those deaths would go away. And so we need to be evidence-based, as Mrs. Ruto noted. We need to realize that healthcare is resource-intensive as we try to make it more efficient. In community outreach and engagement, trying to make sure that the Cancer Center has a relationship with the community it serves, understands the community it serves, and actually contributes to it. We have a series of community advisory boards and meetings and get out into the community and talk. We also listen, and that's very important. Now, one of the most important things we can do is health promotion, health education about risk reduction and prevention. And for example, Dr. Galiat Santos, who's in the audience here, has established a series of internet meetings at 11 o'clock on Friday morning, primarily with ministers and other leaders in the community. It started talking about COVID, but it's spread to other chronic diseases, even end-of-life planning. We also realized that in terms of health promotion, smoking as well as bad diet, which is usually too many calories, not enough physical activity, and obesity are the leading causes of cancer and many chronic diseases, cardiovascular disease and diabetes. And so we've done a great deal of health promotion trying to help people understand that problem. Dr. Gettelson is in the audience, and he's done a great deal of work looking at food deserts and food swamps and interventions to try to overcome those things. Now, in listening to the community, we found out they were very interested not just in breast cancer or cancer, but they want to hear about prevention of diabetes, cardiovascular disease, even mental health. And so we have really tried to gear many of our health promotion messages, our education messages, to be broad. And we've also tried to talk to young parents, because prevention of cancer prevention of breast cancer of a 50 or 60-year-old woman is a pediatric issue. It's what she eats, how she exercises, and a number of influences that she will undergo when she is 5, 6, 7, 8 years of age that will affect her risk of cancer when she's in her 50s and 60s. And so that's our philosophy, and that's how we really work within community outreach and engagement at the Kimmel Comprehensive Cancer Center.
Thank you, Dr. Brawley. The next topic, we're going to turn, Dr. Biden mentioned the patient navigation piece, but let me give her credit that she won't take for herself. With the First Lady's leadership, for the first time ever, there is reimbursement available. So you can get coverage for patient navigation both through Medicare and through private insurance. And so we're really excited about the difference this is going to make. We know from research that I know we're going to touch on in just a second, that it improves outcomes for people. It improves how they feel and their families feel about their care. And it improves inequities, which is a huge aspect of what we're trying to do with the Biden Cancer Moonshot, and I know the work that Her Excellency leads as well. So Dina, over to you to help talk about some of this.
Thank you. It's an honor to be here. My work in the Cancer Center is a role that has me connect components of our Cancer Center so that we can think about that path from outside, if you will, to inside the Cancer Center. So I connect clinical research, community outreach and engagement, and population sciences. So when we look at navigation, there's a parallel to the path that a patient would take from outside in the community, thinking about cancer risk reduction and screening, to what happens through that path to survivorship. So the work that you've done, First Lady Biden, we appreciate because it gives us the opportunity to think and expand on navigation services that are taking place now. We have several navigators, as many cancer centers do, in place. Historically, those were roles that may have gotten separated a little bit. It was a nurse who navigated some, but maybe her primary role was not that of a navigator. So funding those positions was more of a challenge then, so you tried to have double duty in those roles. But thankfully, because those people are in place, that means we have experts along the path of navigation. So one thing that we've proposed, and it's in our DC, so our Sibley Hospital, and 2 of those navigators are here. It is a program that was funded. Ariel and Alana, there.
You are important people.
They are very important people, and we are grateful for the generosity of the Kovler family who funded the Kovler Community Cancer Corps, and those are the 2 navigators. What we proposed is that we should think about navigation as we do precision medicine. So the goal of precision medicine is to get the right treatment to the right patient at the right time. If we think of navigation that way, it means that navigation will look differently depending on where you are in the path of care. If I need to navigate you to screening and you have a transportation problem, meeting you with those resources is very different than if you have a diagnosis and I need to think about getting you to multiple radiation therapy appointments or clinical trial appointments. And it also means that those navigators are potentially different people. So thinking about Ariel and Alana's background is that of an infusion nurse. She's taken care of oncology patients for a long time, and she serves as a navigator to help people navigate that therapy. Ariel is what we call a lay navigator. She is from Ward 7 and 8. She is, in her life within the hospital walls, a financial counselor before she became a navigator. So she thinks very differently about the challenges a patient might face. So we're happy to have that program in place, and we're looking forward to expanding it to peer navigation, because that too looks different. If we can have a survivor navigate a patient, it's a very different, impactful relationship. And in East Baltimore, we're starting to figure out what a precision medicine program would look like there. Because also, although some of the challenges are the same, the community is very different. And to Otis's point, for us to listen to who we serve means that we're respectful in delivering that care, meaning that we will deliver patient navigation programs that really show that we understand what your issues are, and not by categories of patients. So not minority patient navigators or a navigator for women. It is about that community and what you need at the right time, and that should evolve over your care.
Thank you, Dina. And thank you for making that connection to what Dr. Brawley said. I think that also applies in the work that we were just talking about with Her Excellency around the partnership between Kenya and U.S. research, and how delivering what makes sense in the context of what that clinic looks like or what that environment looks like makes a big difference, and that communication is so important in developing that. So the example applies in DC and Baltimore, but all the way to what we're doing across borders. And finally, I want to bring in Dr. Jean Clark to add her thoughts here.
Thank you. Thanks so much. Thanks everyone for being here, and I think I'll pick up on some of the themes that have been said. So I'm a specialist in internal medicine. I'm not an oncologist. and I have the privilege of directing the Brancati Center for the Advancement of Community Care. And our mission really is around overall health, of which cancer is a big part, but there's lots of other non-communicable diseases in particular. And we know in different locales, and in Baltimore City in particular, that the mortality rate is very high, and it differs by neighborhood, where in some neighborhoods in Baltimore City, the life expectancy is 20 years older, or you live longer, than in a neighborhood just a few miles away. And so this idea that we need to meet people where they are in their community, for us, we take that as a neighborhood by neighborhood kind of approach. And we're really, our approach has been to partner with communities, with community organizations and community businesses to really think about their needs and how we can address them. We look then to develop with our partners programs that are evidence-based, that are driven by outcomes, that are focused on health, and that are ultimately sustainable. And so funding these sort of work is very important that we can continue on there. I'm going to focus because on a lot of our approach has been on lifestyle factors, as Dr. Brawley mentioned. Diabetes and obesity, we know, fuel about 25% of cancers. And so we've been focused on some of those lifestyles. More than 37 million Americans have diabetes, but 97 million have pre-diabetes, which is a risk factor for diabetes. And so the good news is we know how to prevent diabetes. We work with the CDC's National Diabetes Prevention Program, and we've been implementing this in our community now for about 8 years. We've run over 100 groups. It's a group-based lifestyle program. We've touched over 1,200 lives, and about half of them have met the outcomes, meaning they've reduced their risk of diabetes, but also cancer, also kidney disease, also these other things. And as Dr. Brawley mentioned, while that program is all focused on adults, one of the faculty members with me, Dr. Venkataramani, is working on a program to address prediabetes in children. As we know, unfortunately now at young ages, people are developing diabetes, and so trying to figure that out. Cigarette smoking is another strong risk factor for cancer, as we all know, but also other things like heart disease and stroke. And so we've been working, partnering with public housing units in Baltimore City, using a program, using our community health worker, Tanya is here with us today, to deliver a community-based, a computer-based interactive program on smoking cessation, but also counseling and discussing lung cancer screening with them and trying to link them to care. I think lastly, I'll just talk about our educational program. We've been partnering very closely with Cancer Center on that, and we're trying to address directly community needs, what they know about that, how they can do that. We're also interested in educating the next generation of providers, going with people who may not have, who are disadvantaged, maybe not have anyone else in their family go to college, and how can we make it easier for them to go to college, to go to professional school, so we better represent the population in who our providers are. And then lastly, for those who are already providers or already in training, we try to educate them about these community-based issues and how they can really be more in tune with what's happening in the community around them. So thank you again for the opportunity to be here.
Thank you.
Thank you, everyone, for your remarks. I am delighted that what it showed was the themes that we talk about as part of the Biden Cancer Moonshot and what that looks like in action across prevention, early detection, supporting people, driving innovation, and making sure that we're getting screening out to everyone. So thank you for everyone for participating. I think going back to where both of you opened us, I heard a lot about the human side, right? Like this, all of this is interesting, and the innovation is mind-blowing, but in the end, it's about improving the health and lives of people in these countries and around the world. So thank you for your continued leadership, and thank you, everyone, for joining us.
Yeah, and thank you to the press for being here and really letting the people in our communities hear about what we're doing, what can be done, because I think with cancer, the one thing we have to focus on is hope. And I think you all and what you're doing, you give us hope. So thank you. Thanks.
That will be perfect. Dr. Jaffe? Dr. Jaffe?
Dr. Jaffe. Where do you want to
I think that's perfect. Perfect. Maybe
Hey, Joel, I can
Take a few turns here.